Okay, hello everybody. I am here with Sam from Sam Massage Therapy. We are here to chat about all things C-section, scar relating, probably more than that because we like to talk about these things. But yeah, we're just going to give a little bit of information on C-section, scar, massage, and I'm waffling. Anyway, let's get started. Sam, tell us a little bit about yourself.
So my name's Sam. I am a self-employed massage therapist. I specialise in remedial work for pre and postnatal. So really to explain what remedial means, if somebody comes to me with a sore shoulder, certainly I can massage that shoulder, but I'll take a look at the whole body to really ascertain why that shoulder is sore. So, it's trying to get to the root of issues, and I apply the same principles to the pregnant and postnatal lady and the issues that they may be having. And that's also why I got really interested in C-section recovery. I was a C-section lady myself, gave birth 5 years ago, and it just fascinated me how you can have this abdominal surgery and sent happily on your way, and yet there's lots of things that you're just never told about your surgery, and we don't even really appreciate that we have gone through major surgery and that our bodies ultimately have changed because of it.
Yeah, I think that's one of the biggest things that shocked me about having the section I had with my last was just how little information. I mean, I knew they didn't really give that much information, I think, until I actually was there and realised, wow, they just don't tell you anything.
Yeah, exactly. Yeah.
Having 2 other children and being told, no, you don't lift anything heavier than your baby for however long. It's like, that's not really possible when you've got like a 2-year-old. So yeah, it's kind of difficult. Okay, so should we just crack on into the...
Yeah, absolutely.
Okay, so why is scarring from a C-section procedure an issue?
Yeah, so I think we really need to take this back to what exactly a scar is, to try and understand how it can affect our bodies. Scarring can happen anywhere in our body, but we tend to know scars as the scars we get on the superficial layer within our skin. And if we think of the cells of our skin, when they are performing well, then they should perform, and I'm going to give a bit of a weird analogy here, but it's a little bit like very nicely brushed hair. So all the cells are aligned in a linear fashion. That hair has a lot of movement, so that skin has a lot of movement. There's a lot of elasticity, and that's the way that we want the cells in our body to perform. When we cut ourselves, then the healing and repair process means that our body tends to overflood the area with an overproduction of cells. So those cells just kind of get almost thrown at the area, like you will heal, you will heal. And as such, it can become a bit messy. So it's more like tangled hair, like a bit matted. So the structure of these cells then lose their elasticity, they lose that flexibility and that movement. And that's a little bit like what's happening with a C-section. Except we don't just have one layer of repair going on, we've got up to 5 layers of stitches that take place during the C-section. And I think a lot of us don't realise this. The outermost layer is the skin, the one that we all see. The innermost layer is the uterus or the womb. And between that, you've got other layers of stitches going on. So that's potentially up to 5 layers of healing and scar tissue. And that scar tissue then produces congestion and what we call adhesions, which is kind of quite a common term. And those adhesions get sort of, well, as I said, sort of congested. So it's sticky, the tissues don't move smoothly against each other anymore. So there's a lot of then sort of, for want of a better word, things are just not functioning optimally in that area. Okay? So this is where scar massage can be really beneficial. Sorry. I think, so, you know, that congestion itself can cause restrictions, and you often hear people talking about feeling quite restricted in the area, like a tugginess, range of movement isn't as good. And so by freeing up those layers, you can help improve range of movement. I think the other thing we need to remember is that this C-section scar is slap bang in the middle of the body. So it's kind of quite a crucial area. So let me just draw the diagram here. And I know this is something that you deal with a lot with your postnatal work. So if we have a nice wee woman, can we see that okay?
Yeah.
Yeah.
I'm glad you're drawn and not me.
Sorry, feet here. So we've got nice big hips because, you know, childbearing hips here. We've got pelvic floor down here, and we've got diaphragm up here. Mm-hmm. And then bang in the middle, round about here, we've got a nice C-section scar. Okay? And I mean, you know, this is something that you obviously preach to your women a lot. Postnatally, we're trying to rehab the core functionality, so we're getting breath, like diaphragm, and pelvic floor working together.
Yeah.
And we need that in order to optimize pelvic floor function, to help diastasis, to help tummy gap come back together, and to really make sure that postnatally we are breathing correctly again, which is kind of, you know, often really overlooked, and a lot of men and women don't sort of underestimate the power of breath, but it's sort of intrinsic to the way the core works. So, you know, ideally, you know, pelvic floor and diaphragm should be moving together in a nice sort of synergy. Yeah. But if we disrupt the middle of that, which is basically the communication pathway between diaphragm and pelvic floor, then we can cause a dysfunction there. So, you know, the placing of a C-section scar is really the problem, because it is slap bang in the middle of this core area, which is kind of integral to how everything works. Yeah. Does that kind of make sense?
Yeah, fully.
Yeah. Yep. Any questions for that? It's a bit kind of like random, but it, you know, the problem is it is that sort of midline area which
we
stabilizing.
I don't know if you see this with clients you get coming in, but I do. People commenting on forums, on Facebook, Instagram, where they've had a section and they don't actually realise the impact that it has on their pelvic floor or how the whole core works. They're just thinking about the scar and healing that up. And yet definitely really helpful to hear, like, the fact that it's 5 kind of layers that you're going through, because that didn't come into my head before I started all of this. I didn't realise, even though that makes sense. I didn't realise that was the case, because I think that's because they just don't make a big deal about it. It's not really seen as major abdominal surgery, whereas when I got my appendix out, I was given a lot more information on how to deal with that than I was with my So,
I mean, I think the key thing is that, you know, the muscles aren't cut or shouldn't be cut. You know, for some very small situations they are cut.
Yeah.
But just because the muscles aren't cut, it doesn't mean that those soft tissue or connective tissue layers still aren't important. You know, you've got a couple of layers of fascial type tissue in there, which are really, really, you know, they serve a big purpose.
Yeah, absolutely. That I still suffer from the issues with not having the connective tissue working the way we want it to work for me. So it's incredibly important to
and just going back to that pelvic floor thing, I mean, I have so many ladies who say to me, well, you know, I didn't have to do the pushing, or, you know, for elective sections didn't have to do the pushing. Therefore, you know, my pelvic floor will be fine, won't it? And it's like, well, no, you still carried a baby for 9 months. It's that carrying which is the issue, and then you've got this issue of the C-section, which can disrupt the communication to the pelvic floor.
Yeah.
The other reason, I'm just also going to use this diagram to explain how the scarring can affect the pelvic cavity, because, you know, not only is this scar slap bang in the middle, it's also close to quite a few sort of major organs. So can you see this okay?
Yep. Nice.
Yeah. So we've got, so this is the front tummy. We've got bladder here. I'm not sure these will end up reversed on the video. So bladder, uterus or womb, and then bowel come down into rectum here, and bottom at the back. Okay. So what I kind of want to visualize here is how the scarring then moves back towards the uterus as the uterus shrinks. So when we are, and therefore how it can impact the organs. Let me just get the right colour. When we're growing a baby, our womb obviously starts to expand. So we've got womb coming out here, and making a nice big baby bump at the front here, okay? And then our skin will obviously stretch around as well, okay? So that obviously squishes bladder down, hence the reason we need to pee so much during pregnancy. And then if we birth by C-section, we're obviously going to make an incision here. So we've got the scar on the outer layer, and then we've got the scar, so the most inner layer scar will be on the uterus, the womb here, okay, in order to take baby out. This scar here, though, will obviously, as the uterus contracts back to its normal size, will start to move back, so that it actually ends up right down, poked in between uterus and bladder, okay? So I think, you know, we tend to think of just this scar here, but the scar tissue is going to come all the way back and sit here as well, okay? And for those, you know, people to heal differently, and some people are more prone to getting adhesions than others, but this here will potentially mean that we can get adhesions form against the bladder wall, okay? So for some ladies, they may experience bladder frequency, because these adhesions can end up pinching against this bladder wall, and that will send a miss signal to the brain saying, oh, you must be full because I'm getting a sensation on the side of my bladder, when in fact you're not, okay? We can also then get adhesions come down past the cervix onto the vaginal wall. So this might cause some discomfort with deep penetration. That's why some people post C-section might have a change sensation during sexual intercourse or putting in tampons. And the last thing it can affect, we've got some little funky ligaments which run from the uterus over to the sacrum here, okay? And this supports the uterus in its place. But we know that when we have a C-section, and you probably know this from your own scar, it's not the same one side or the other. There tends to be a side which might be slightly pinched or puckered. And it's the same with this scar in here. So this is going to pull on the womb unevenly and create an uneven pull on these ligaments. Now, if you're getting an uneven pull on these ligaments, it's going to be pulling on this sacrum, and that will affect this joint here, which you might have heard of the SI joint or sacroiliac joint, and that's what causes lower back pain. Okay, so a lot of ladies post C-section are suffering lower back pain, not really sure why. It could be simply down to this happening here. Okay, I think it's kind of crucial to say this is one scenario. Okay, not everyone suffers lots of women have C-sections and they have no issues whatsoever.
Yeah.
So I think it's really key that we don't get hung up on this and don't get paranoid.
Yeah.
But I think it's also key to know that if we start getting symptoms, and it might not be within the first 6 months, it might be 6 years or 26 years down the line, C-section scar massage might be a route to try.
Okay. Yeah.
By all means, obviously go and see your GP, but it might be a simple fix. So I think it's that thing where knowledge can empower you much further down the line.
Yeah, absolutely. Yeah, this isn't about making everybody think, oh, goodness me, I'm going to have a painful back, or I'm going to have issues with having sex, or needing to pee more frequently. This is just, if you are starting to notice these symptoms at some point throughout your time, that this may be the cause of it.
Yeah, absolutely.
Which makes it easier to get to the root of it and then solve it.
Yes.
Totally. That's what we're looking for here. Yeah. Cool.
Yeah. So I mean, that's really why, like, well, that's the reasons behind the why. Oh, I can't speak today. Why scar? The scar can affect you. Okay. So obviously, going in and massaging that scar can potentially help with these issues.
Okay. So how does it help with it?
So with this, you can improve the flexibility of the tissue. So you're improving elasticity, you're helping the tissues function better, you're helping that slide and glide between the tissues. Okay. So it almost frees up the areas, it gets the blood into the area, it helps get any congestion out of the area, it improves the healing and then improves the functionality of the tissues. With this work, you are literally going in and reducing the adhesions. Okay. Sometimes it's not a quick fix, sometimes it won't make any difference, but it's always a good place to start. Okay. The other thing so I can have quite quick results with some of my clients, definitely in their areas of flexibility, that tugginess, that restriction that they're feeling, just to help free up their body. With this kind of work, it's usually a more sustained approach. And certainly I work with clients, even just improving the look and feel of the scar as well. So by massaging into the scar, you can reduce some of that lump and bumpiness of the scar, some of that puckered look, and even some of that sort of pouchiness that can develop, because it almost creates like a wee banded belt, which kind of stops things from things sit on top of it and things sit below it, but don't seem to be able to get through it. So by freeing it up, it allows sort of better mobility of stuff through it. Okay. So, and improve the sort of the feel of the scar. So a lot of people report that their scar feels quite sensitive or a little bit numb. So again, by working into it, getting the blood in, helps rejuvenation, can quicken up that process of getting sensation back.
Okay, and the C-section scar massage is something you can do on yourself?
Yes, so there's lots of different things. So, well, not lots of different things. You can, so on a link to this video, I'll post up a video link to C-section massage. So you can try it yourself. By all means, you can come to me. And to be honest with you, I would recommend seeing a professional first, just to get in and do a full assessment, have a look, even out all of the peripheral areas around it as well, and just sort of feedback what to focus on. A lot of people sort of want to see a video first or have a demonstration first, just to feel sort of knowledgeable about what to do. Yeah. For a lot of people, it's not the most natural thing to go in and do.
Yeah. I know when I went to Angela, the physio, and she was like, are you doing it? No, I don't like touching it.
Yeah, yeah. And I think it's really important. That's a very, very normal feeling to have. You know, it's something which is really, you know, a slightly alien part of your body now. You know, especially if there is sensitivity there. I think a lot of people, it gives them the heebie-jeebies. So, you know, and I think by having somebody else go in and work on it first, it can make you feel a bit more comfortable with it.
Yeah. She definitely demonstrated it on me, and I just persevered. And it is, once you do it, it's definitely a little easier.
Yeah.
I fully understand that feeling of I don't want to touch it.
You know, and I think for a lot of people, it represents different things. You know, it might be hard going in and even looking at it because it almost represents the loss of your previous body. You know, it's a kind of grieving process. This is my new body, and it takes a while to accept that.
And
you know, oops,
yeah.
we just yeah. I know you work a lot with your clients, you know, in terms of accepting their sort of postnatal body, learning to love it again.
Yeah, because for everyone, but for most people, it can be very visible to them how much the body has changed.
Yeah.
And that might not go back, or might not resemble anywhere near what your body used to be like. So yeah, I think it's very important to work with that on a kind of psychological level to be accepting. But I suppose for some people it can also be related to the trauma of their birthing experience as well. If it was an emergency situation or whatever the reason, it can take time. But going to see a professional about it's probably a good option if it's available to you.
Yeah, absolutely. And I think, you know, what you've just touched upon is a huge thing as well. You know, there can be a lot of emotions tied up in that scar. And it's very important to acknowledge that it might not be the right time for you to work on that scar yet. And that is absolutely fine. And I think, you know, it's this notion of birth trauma is getting a bit more limelight now, and I think, you know, women need to understand that it is common and it's not. Hang on, let me try and rephrase that. Sorry. So, you know, if you are getting feelings postnatally of sort of anxiety and hypervigilance, or a complete avoidance about the whole birth or sort of postnatal period, you know, and these feelings are just not getting any better, then it really is key to go and speak to someone. And maybe you haven't realized it yourself, but you are actually suffering from having been through a traumatic experience. And in most of these cases, you know, medically on paper, the birth has gone absolutely fine. But for you in your mind, it hasn't. And that's the most important thing, is to, you know, to know that having these feelings isn't something you should put up with and something you should just brush under the carpet.
I mean, it's definitely not always something that comes up right away, because I had a traumatic first birthing experience, but was always okay with it. Like, to begin with, I obviously felt the trauma from it, but got over it fairly quickly as far as I was aware. Had my next child and didn't really feel uncomfortable about that either, other than occasional a bit of fear that the same thing would happen to me, but not anywhere where I felt like I needed to speak to someone about it. And the third pregnancy, I maybe had some issues, but that was more to do with the medical problem that I had. But I had a conversation with my friend in the summertime about my birthing experiences, and I just, like, I started crying, and I felt really like, God, that's a lot of trauma that I'm holding in from that first birth, and that was 6 years ago. And that's not something I've ever really noticed about me. And that just happened in the summertime, which again, it was 6 years ago I went through that experience. So it can manifest at any point, and it's okay if it comes up and it's you feel that you need to go and speak to someone about it.
Yeah, absolutely. And just as a note, I mean, hospitals should have people that you can speak to. I do also do an NLP technique, which is a talk therapy for traumatic birth recovery.
Yeah.
So, if anyone wants to contact me on that as well.
Yeah, I think that's really helpful, because for a lot of women, that's where the rehab and therapy from birth needs to start, is
Yeah.
the trauma part of it. Yeah.
Well, I mean, this is so intrinsically, you can't fix this until this is kind of fixed, and the two.
Yeah.
How can you fully appreciate what's going on in your body when your mind's all over the place?
Yeah, absolutely. Okay, so if everything is okay, you don't have any feelings of trauma around your C-section, and you just have the scar there. It's causing you some niggles. When can you start the massage? When would you recommend that?
So what I would recommend is, whether you're having niggles or not, you should be massaging your scar. Now you can start at any point after the scar has fully healed. So as long as there's no tenderness in the area, because that could indicate that maybe there's still healing going on in the lower layers.
Yep.
Obviously no redness or weepiness or infection on the upper layers. So once it's all healed, then you can start going in with a massage.
Yeah.
If the healing is taking longer than normal, so ideally everything should be healed by at least 10 weeks, if not sooner, you have to go and see your GP and get it checked out. Yeah. After this point, what I'd recommend is trying a little bit of massage at least every sort of 1 or 2 days for the first couple of weeks, and then you can start spacing it out a bit, every week, and then maybe after 6 months every month, and then really a kind of as and when you need to, or as and when you remember basis.
Mm-hmm.
And I think, again, what we're saying is, you might not get any of these issues, but then 10 years down the line, you might get sort of something, and you think, maybe a bit of scar massage will help with that issue. Yeah. So, and I think the other key thing is, there may be people watching this video who might have had a C-section 10 years ago. You can do this work at any point. It doesn't make any difference. Okay. So whether it's 6 weeks, 6 months, 6 years, 26 years, yeah. You can go in and start.
That's good to know. Okay, is there anything else that you feel that we haven't covered or you want to add in?
I don't think so, no. Because if I probably just dumped a lot of information.
That was a lot of information, but I think it's really helpful. I think the more information we put out there about C-section and the impacts that it could have is really beneficial for women, because I think we are an underserved population. We are a lot of the population. We're not a special population. We are very much involved.
Especially with rates being like 1/4 to 1/3 of all women giving birth.
Yeah.
Do it via C-section.
Yeah. So yeah, I think it's really helpful to have as much information as possible. The only other thing I want to ask you is, where can we find you?
Oh, yes. So I'm on Facebook and Instagram under Sam Massage Therapy. And on Saturdays I work in East Kilbride. During the week, in daytimes I work from my home studio, which is down in Campus Lang. And in the evenings I do some mobile appointments out to specific areas. So yes, if anyone has any questions, they can contact me at any point. I think I would also like to add as well that, be kind and gentle to yourself. You know, some some people think, oh, I'm going to massage and I get in there right deep, and it's like, no, just start off nice and gentle. You barely have to do much to
Yeah,
start making a difference.
yeah,
And when we're doing the video, will show you how to access the deeper layers, which will be these layers.
yeah.
Make sure you don't have a full bladder when you're doing that, because it's not going to work. But again, be gentle. If there's any discomfort or any pain, tenderness, you just stop. And if you are not sure about anything happening in your abs, in your tummy, with the pelvic organs, go and speak to someone, because the amount of women who just sit on issues and don't talk about them and then get quite upset about them, it's not worth it. The GPs are there for you. Women's health physios such as Angela are there for you.
Yep.
Sometimes actually just talking about them can help.
Yeah, absolutely, absolutely. My next chat is actually with the GP.
Oh, fantastic.
Which is going to be fun. So yeah. Okay, great. Thank you so much for coming on here and giving us your time and
No, thank you for having me.
getting this information out there. Yeah, I'm sure we'll probably do something like this again, maybe in person or something. But anyway, I'm going to stop the video now.